Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Fiber, fluid, exercise, stress management, good sleep, wash your deodorant off, and no underwire bras. So, fiber. First thing we want to do is get 25 to 35 grams of fiber in our diet a day. To see if you're doing that, keep a fiber diary for 3 to 5 days to see what your baseline fiber intake is. If it's not at 25 to 35 grams of fiber, for which most people it's not, then start adding ground flaxseed to your food, eating fiber-enriched foods. Then there's fluid. Basically, we want to be drinking a lot of water. 64 ounces is the classic answer. We also want to be minimizing caffeine. 1 to 2 cups of coffee a day is totally fine, as well as minimizing alcohol. We don't want to be having more than 7 alcoholic beverages a week, and certainly not saving them all for the weekend. But alcohol has an association with increased expression of breast disease and breast cancer. So fiber, fluid, exercise. What we're looking for is 30 minutes of walking outside every day. For some reason, that has a greater impact on cancer prevention and breast disease prevention than going to the gym and hitting it out. Now, adding in 2 to 3 weightlifting sessions a week also seems to improve breast health. But we really want to be getting outside and walking outside every day for 30 minutes if at all possible. If you're not able to do that, try and move your arms. The idea is to get your heart rate up. Also, park your car far away, walk around the outside of the grocery store. Remember, all the good stuff is on the edges of the grocery store, and all the bad stuff or more processed food is in the aisle. So stay on the edge of the grocery store and do multiple laps if you need to. And then there's stress management. So stress management can be through meditation, mindfulness, yoga, learning mindfulness-based stress reduction techniques, gardening, anything that helps get your heart rate down and gets you into a clear, calm place. Good sleep is vital for health. It's the time where our body heals. We get into that parasympathetic, very calm relaxation response. And even if you can't sleep, resting can be very important. So even if you're feeling like you can't sleep, just being able to rest, be calm, listen to some nice music, just get yourself into a resting, supported state on a surface that can help be relaxing. So fiber, fluid, exercise, stress management, good sleep. Those are the top 5. And the next 2 are bra wearing and washing off your deodorant. We want to be washing off our deodorant every night like we wash off our makeup because we have 4 ways of excreting toxins from our body. The whole idea behind all of these is that fiber will bind toxins and fluid and exercise will flush them from our body. At least that's the theory that we have. We have 4 ways of excreting from our body: our breath, our sweat, our stool, and our urine. The breast preferentially drains out through the axilla, or what we commonly call the armpit. So we want to use deodorant. Aluminum-based is fine. Aluminum-based deodorant is what provides the antiperspirant qualities. We don't want to be wearing deodorants that last for 3 days because it's blocking that special area of drainage in your armpit. We want to just be wearing deodorant that we can wash off at night to allow that sweating to happen, especially overnight. And then the last piece is not wearing underwire. Underwire bras, there's my puppy. Lucy says hello. Underwire bras decrease blood flow. They'll cause a ridge underneath your breast. They're very unhealthy for us. The cups never fit our breast properly. We always have one breast is larger than another. So those stiff cups will compress too much on one side, which can cause damage and we believe could lead to benign disease, as well as the other side gets traumatized as it's banging around often. So we really recommend against stiff-cupped underwire bras, and we recommend that we wear wire-free bras made of Lycra or spandex, sometimes using a cover over them, like a little nursing pad that usually comes with the bra that looks beautiful. I promise you, even very large-breasted women get great lift and support through these wire-free bras nowadays. They're not sports bras, which compress too much, because that also doesn't help blood flow. Sports bras are for sports. Wire-free bras are for the everyday user walking around town. And if you really want the cup or underwire for a special event, go for it. But please don't wear them on a daily basis. So the 7 things we're looking at: fiber, greater than 25 grams. Fluid, drinking a lot of water, minimizing sugary drinks. Exercise, trying to get 30 minutes of walking in every day or somehow getting our heart rate up. Weightlifting can also help, or just some weight training, even through yoga. Fiber, fluid, exercise. Stress management, good sleep. Change your bras to wire-free and wash your deodorant off at night. Those are the main things that we talk about for excellent breast health as well as cancer prevention.